Hello and welcome to Pune Times Mirror. Today, we are going to have a conversation with the celebrity psychiatrist and sexpert, Dr. Rohan Jahagirdar. Hello, sir. How are you doing today?
Hello, I'm doing well. Thank you for having me. Namaskar.
At what age is depression usually seen in people?
There is, we cannot average it out, but what we see today is depression is very common. The age group varies. We call it depression in teenagers, also will be classified, or adolescents. We can see it right from adolescents to a geriatric age group. The reasons are different, like I said. So there is no specific age group that I would say. It comes in all age groups, certainly from the adolescent to the geriatric. My youngest case that I have treated of depression was around 16 years old with major depression, and the oldest is about 72. So the range varies.
Okay.
See, again, depression, unfortunately now is a common English word that people use. One has to understand depression is a mood. Mood is emotion which is going to be, or a mood is something that you constantly feel for most of the time of the day, for most of the days of the week. It's not a momentary thing.
Yeah.
And only when you experience that for a period of at least 2 weeks, that one can call it a depression. So, depression is rampant, and answering your question, it is seen in most age groups, not specifically in any one type of age group.
Okay. So now, sir, what is treatment-resistant depression, that is TRD, and how can it be cured?
So treatment-resistant depression classically is when more than 2 antidepressants are tried for a patient. Different types of treatment regimes are tried, and yet the patient does not respond to the kind of treatment. When we say response, it is at least reduction in about 50% into the symptoms.
Okay.
So treatment-resistant depression is when, like I said, classically we have established over a period of time that even after using medications, the patient has not responded. Then other measures can be used, like use of electroconvulsive therapy. Nowadays, ketamine infusion. There are multiple ways that can be tried. Combination of drugs, change of drugs which have been drugs as in medication which have been used for them, adding a mood stabilizer, adding low dose of antipsychotic, depends again on type of depression. So to call something treatment resistance, there are criteria. If they fulfill it, multiple other ways can be handled by simply introducing different types of regimes which have not been tried before.
All right. So now, what is the most promising recent development to cure depression?
Okay, so I personally feel there are multiple recent developments. The biggest recent development as a society, I believe, is the acceptance towards mental illnesses.
Right.
I think that's the biggest change. The second, today, in terms of medication, also, if you speak, see, our concepts of medicine are very different. We still feel that the medicines are there only to make people sleep, only to make people groggy. No, that is not the case. Today, one of the most important criteria that we use in terms of treatment is functionality of the patient. So we want our client to be functional, even if they are taking medications, and that's how the medicines are designed today. So the changes that we see is advent or availability of new good type of medicines which are really effective and with limited or very less side effects. Use of new drugs or use of, like I said, now for example, ketamine infusion is one of the latest things that has come in. And what it does is, like, if I am having suicidal ideation and if you are given antidepressant, normally a drug takes about 2 weeks to act. So it does not mean that the patient has to suffer for 2 weeks. The treatment like ketamine infusion would ensure that the patient starts feeling better. It's an addition to the treatment. So advent of new medicines are there. Exposure and availability of latest information is there. So, but I would still say, besides the new things that are coming, the biggest change is, as a society, we have started accepting mental illness as a problem, including depression.
Right, absolutely. Now, sir, we also see depression, on the rise amongst today's youth. Several people from the age group of 16 to 26 or 16 to 30, so to say, they keep saying that they are depressed or they are feeling depressed, etc. So, what kind of simple measures or advice would you like to give to them?
So the age group that you mentioned, 16 to 26, is actually one of the foundational age groups of your whole life. So basically, if you get your steps wrong during that time, I think you will have to pay the price for the next 25-30 years. So why is it very common during that age group? A, because hormonally or physically they are the most active, one of the most active age groups.
Right.
You want to explore many things, you are doing many things. Most people do things out of peer pressure, so many other factors that come into play. Also during this age group is the time, like I said, if you are aiming for certain thing and that does not happen, in terms of choosing a career, in terms of going ahead, chances of having disappointments, chances of having all those things are very high during that phase. The other thing that is important during this age group is onset of many psychiatric illnesses happen from adolescent to roughly 25 age group. So anybody who is predisposed to that condition, there are very high chances that they may experience onset of these illnesses. What are the simple tips that they will have to address to it? One is being aware that mental health is extremely important and focusing on the right things at the right time. So for example, a 16-year-old, if he suddenly wants to act like a grown-up man, that is not going to work. So similarly, if he acts like a child also, that will not work.
Yeah.
So making sure they understand what is important for their age and doing the right thing. Taking professional help. So today we have schools providing, their counseling, schools providing them guidance towards what type of selection of career is to be done. Tests like aptitude tests, all of those can guide you to help make the right choice, thereby saving you from disappointments in future. One other factor in this age group is communication. The difficult part again is they are not small enough or young enough to call them children, and they are not old enough to call them adults, especially the 16 to 18 age group. And that is where most communication fail, and that is why they get associated with the peers. Unfortunately, if they have a wrong peer group, that becomes a tricky situation. So again, another tip is that keep a line of communication. If required, take professional help. Understand indulgence into any wrong things. Recreational use of things is different, but getting habituated into something at this age would be wrong. Focusing very clearly on what is to be achieved in the next few years is extremely important, because you're going to carry that for the next 25 years.